Welcome to CouncilCast, a new podcast series from the Council of Insurance Agents and Brokers. I'm Cheryl Matochik, the Council's Senior Vice President of Strategic Resources and Initiatives, and head up the Employee Benefits and Healthcare Business Intelligence Division of the Council. Our CouncilCast guest today is Kate Begley, Senior Vice President and Head of Sales at Health Advocate. Health Advocate is a leading U.S. national health advocacy, patient advocacy, and assistance company, and it really serves a wide spectrum of folks. They have about 11,500 clients and 40-plus million people, and really they're serving them in a number of ways, offering a spectrum of services to help employers, employees, and consumers navigate the healthcare system and facilitate interactions with insurers and providers. It's a privately held company at Health Advocate. It was founded in 2001 by former Aetna executives and is headquartered in Plymouth Meeting, Pennsylvania. Health Advocate employs, just for example, registered nurses, medical directors, and benefits specialists who really address a range of healthcare and health insurance issues. So, just to get a little bit more specific, they have personal health advocates helping, members locate providers, address errors on medical bills, answer questions about coverage denials, and assist with insurance appeals. So Kate's, with us today, which is wonderful. It's great to take this opportunity to sit down with her and dive into a little bit what's been going on at the company. Kate's responsible for sales strategy and the sales growth of the organization, and oversees the account management team as well, and their vast network of distribution partners. So, Kate has a long career in the health insurance space. Before Health Advocate, she worked in a range of senior positions at Aetna and really led their specialty sales division with responsibility for life, disability, dental, and vision. So welcome to the podcast, Kate. And I thought we'd just kick off. Maybe you could tell me a little bit about what is unique about Health Advocate's core business, a little bit about the scope of the company's capabilities. You guys do a range of different things for employers, employees, and consumers, and sort of where the company is in its life cycle.
Yeah, that'd be great. Well, thank you, Cheryl. I'm thrilled to be here. So when I joined Health Advocate, I think what I found to be, I guess, is refreshing is the fact that it's a high-touch, personalized service. And so, in today's automated, high-tech world,
sure,
I think this is one place where having someone who can pick up the phone with some compassion and say, how can I help you, without having to jump through a bunch of prompts is a really wonderful thing. The people who call us, it's usually as a last resort. Many times, they just found out that someone in their family was diagnosed with a serious illness, and they've went on the web and they've talked to friends and they talked to doctors, and they're confused. They don't know where to turn, or they have a $5,000 balance bill, and they don't know where to go. They've called the health plan, they've called the doctors, they can't get it resolved. They're stressed, they're frustrated, they're upset, and to call us and not be sent through a bunch of prompts and have someone there who says, we're going to help you, we're going to make this okay, is something that is, to me, invaluable. And it's something that we offer at a very low cost to the employer. And so I think for the member, it's a true health concierge. And, when they started the program 15 years ago, the intent really was, if you have a claim problem, you have a benefit problem, or if you need some clinical assistance in either finding a provider or understanding a health diagnosis, they're going to be there to help you and help you navigate the healthcare system. You said, how has it evolved? It's really gone from someone resolving an emergency room bill. We called the doctor and we found out it was coded wrong and got it paid correctly. And the member's happy. They went away. They're happy. We were happy. It all worked out well. Employer was thrilled. They weren't having to deal with an upset employee. But how it's changed is really we've educated our advocates to ask the right questions. So now when they see that emergency room bill and they see it's a child who had asthma, they're asking a few more questions. And what they might find out is the mother said, well, I couldn't afford, the new inhaler that was prescribed. And then we're going to help them figure out another way to be able to get that prescription filled. Or we might say, hey, did you know that your health plan has a chronic management program for asthma? Can we help you connect with that program? So we really have gone from a transactional to a clinical resolution of an issue and help that member in a very non-intrusive way, be able to get better health and more productivity for their lives. They can take a claim to us, and we're going to say, we're going to take that from you. Or if it's that diagnosis I was talking about,
sure,
we can say, all right, for your mom, you've told us what the issue is. Let us do some research, and we're going to get back to you. And we're going to get back to you when it's convenient for you. Right? And so now that person can go back to work. And that's really the value that the employers see, right? The employer's like, okay, I get that, because they only can resolve those issues during the workday. So I think that evolution from the advocacy standpoint really went from something that was transactional and really helping resolving an issue to really taking that next step and trying to close a gap in care.
Absolutely. I mean, I think that's the most important part of the healthcare process is when a problem arises, who do you turn to? And, in this digital age, as we move from analog to digital, everybody's first probably bad notion is to go online and Google search and WebMD everything. But to have a place to go that's part of your benefits program. And, I think in this day and age, a lot of people think of, technology replacing the human aspect. But I've always thought about it as just a humanology component where you have technology sort of complementing, what is the sort of, most important part, though, of this equation is always been that human compassion component and someone that you can really talk through issues, especially when it comes to healthcare and medical issues. So I think it's a really interesting. Who do you guys in the marketplace? I mean, who was in this space? Who do you guys compete with the most in the employer world that was doing patient advocacy work and wellness advocacy work prior to Health Advocate sort of really taking off in the space?
So I think we may have been one of the first. This was 15 years ago. Now everyone is an advocate.
Right.
I will tell you, there are so many advocates out there. I think one of the big advantages that we do have is just our scale. So there's a lot of handheld health concierge, right? And they're going to say, it could be a pricing transparency company, and they're going to say, we're an advocate and we're going to engage people and we're going to get them to, use all these different benefits. But I think the high-touch service, there are a handful of competitors out there, and they're all different models. There's the Accolades of the world, the Quantums of the world. You have the high-touch one, the high-tech ones like the GIFs, where they're not actually delivering the service, but they're engaging members to get to the different offerings that an employer has through an app.
Gotcha.
So, there are different ways to approach it, but I would say every advocacy organization out there, they have a little bit of a different approach. There's companies that really specialize just in second opinion. There's companies that specialize really in the doctor search and helping you resolve the claims. We have a very broad offering, so it really is the full spectrum from helping with the administrative to the clinical and helping, if a member comes to us and they need a second opinion. Here's a great example. So today, very important is that they have high deductible health plans. Employers want them to maximize their benefits, so they're giving them pricing transparency tools. So Health Advocate we're our own pricing transparency tool, but we'll also help members figure out how to use the pricing transparency tool that maybe the health plan has, or maybe the employer bought what they thought is a best-in-class freestanding tool. But what ends up happening is the member, once they find out, okay, here's a location I can go to, and here's something that I can afford, we take it the next step. We say, okay, we found you a location. Can we schedule an appointment for you? So we're getting them to take action. And then after they've gone, if they find out and they're diagnosed with something that's a little bit more serious and they do need a second opinion, then we're able to help them do that as well. And so I think, you have the technology marriage with the high tech, with the high touch.
Absolutely.
And I think that's what the difference is. Having a tool on its own, it's hard to get people to go and use that tool. And I think that's what a lot of employers are finding. They're buying wellness programs, they're buying EAP programs, they're using great tools. The technology is phenomenal, but they're getting no usage on it. And so, that's one of the things that we have some other products that I can talk to you about that we're really helping to drive engagement into all of those tools.
Yeah, as a follow-up question, I was going to ask you sort of what is one of the sort of the fastest growing area of the health advocacy sort of business mix right now. Obviously, one of the it's just on the national spotlight and probably the next big battle in Washington, D.C. is really going to be around prescription drug, especially drug pricing. So I was curious, do you handle a lot of medication management calls where people are looking for advice around, that component? What do you all do in that area?
Yeah, so 2 questions, and I'll answer both of them.
Sure.
So absolutely. So we'll for that example of the member who couldn't afford their inhaler, we're going to help them find a more cost-effective alternative to that. But we also, if we get the claims data from the employer, we are able to help find gaps in care, and everything from doing biometric screenings for the employer, taking that data, seeing who are the hypertensive members of that group,
sure,
and seeing who was prior to that compliant with their drugs and who was not, and being able to do things like doing outreach to them with mailers to get them to be more compliant, or having a health coach work with them right after they get their screening to say, you need to take the next step and see your physician to try to help close those gaps in care. But the big question of engagement, and probably the most popular thing I'm seeing employers asking for from Health Advocate, is how can you help us drive engagement into all of these different programs? And so one of the programs that we have, it's called Benefit Gateway, but it's more or less a Super 800 number. So what the employers will do is they'll say to their employees, no matter what your health issue is, call this 800 number, and you're going to work with your health advocate, and they're going to help get you the care you need, or they're going to transfer you to the place that can help you. We do it in 2 ways. One, if they have different vendors for wellness, they have different vendors for EAP. We're going to learn everything about those vendors that we can. And then when the member calls in and we identify that, hey, this member could use that asthma management program, we know the health plan has that, we're going to connect with the individuals within that health plan to help the member get to that care. That's what we call our Benefit Gateway model. All the calls come through us. We have the claims status from the employer. So we also know that perhaps you're up for mammography and you haven't had one. So after we help resolve whatever that issue was, we may say to you, hey, we see you're up for a preventive visit. Do you have a location to go to? Can we help you find a provider? Can we help you schedule that appointment? So again, trying to help close those gaps in care. So when an employer gives us data, we have an educated health advocate that can really take the care to the next level. So that has worked really well. Employers then said to us, well, what about you offering wellness and employee assistance, et cetera? So we'll do it one of 2 ways. We'll have our Benefit Gateway 800 number where we'll work and really understand all of the different vendors and make sure people get to the right care at the right time, or they can offer all of this through Health Advocate. And so when they do that, they may be eliminating 5 or 6 or 7 vendors. They're going to have a lower cost, and on top of that, they're seeing higher engagement. And so that's what we call our empowered health model. It's more of a holistic, integrated
solution.
Yeah.
That's wonderful. I think, one of the follow-up questions I have to that is, what are some of the, has there been any reticence on the part of, you talk about sort of a vast network of distributors that you work through. Mm-hmm. Obviously, the council represents the leading, benefits brokers and consultants in the country. Has there been any reticence on the part of any of those partner groups to really bring you guys in? Obviously, this is an area that can be a little bit, sticky. And so I was just curious, describe some of the barriers or things that you've seen that you've tried to overcome and have overcome, and sort of how you're working, how the brokers and employee benefits consultants have, responded to Health Advocate.
Yeah, that's a great question. And I would have to say that the brokers and consultants really contributed to Health Advocate's growth and success. So I think they saw early on, and as our productivity model, they recognized that if employees were trying to resolve claims during the day, they probably weren't being very productive.
Right.
And so that very soon they were like, hey, this is a good thing, and we need to educate employers on the fact that this benefit is out there. Many brokers and consultants actually pay for us for their clients, which is really unique. But I think the bigger thing today, they're having to work with employers and make some really tough decisions. Employers are having to move to high deductible health plans, for example, right? Because the healthcare costs are, rising, and even if they're slowing to a much lower pace, it's still an enormous amount of money that they're spending on benefits. And so when you move to a high deductible health plan, you put in an HSA. That's going to help people. It's going to defray cost. Now, the employees are confused. HR department's going to be overwhelmed with questions.
Right.
That's where they see us as a great partner. And we actually have, we're offered in most of the major exchanges. In some exchanges, we're embedded that we're absolutely offered to everyone who goes into the exchange. And the reason for that is they need someone who can spend the time to explain what a high deductible is, what the advantages of an HSA are, why, what's a narrow network and how does that work, And so when we do a provider search, we make sure the provider's in network. We're explaining to the member, here's what your cost would be if you went here, here's what your cost would be if you went out of network, and, here's the providers who can best take care of this certain condition. So,
yeah, I think, it's an important role. I mean, one of the things that we've, been talking about, and I know a lot of our brokers and consultants, but having you as part of this equation would even expedite sort of their focus on creating and more health literacy and transparency in the process. And I think, healthcare has gotten so complex in the last several years. It was complex before the Affordable Care Act. And I think, with companies like yourself, that transparency piece really starts we all know we have a long way to go. But that's really one of the important things as consumerization, grows, that's the important piece for people to get comfortable. So I can completely see why, obviously in the exchanges and in other consumer-driven models that health advocate, that's been sort of a target segment for you guys. Yeah. So you mentioned wellness, and, one of the things, workplace wellness programs, they vary in the services and activities they include. About 3 in 10 large employers use incentives to encourage employees to participate. And depending on those programs' characteristics, we all know there's a lot of different federal rules that apply. And, just a couple weeks ago, I think everyone was waiting with bated breath to see what the EEOC would say in their final regulations that they would release, basically looking to change standards applicable to certain workplace wellness programs that use incentives to encourage workers and their spouses to provide personal health information. So I was just curious, what your take and your thoughts are on the impact of those final regs and whether or not they balance what they sought to balance, which was, the employer interest in incentivizing workers to participate in these programs against those requirements that prohibit discrimination based on health status, disability, and genetic information. I'd love to hear your thoughts on that.
I mean, the way that, that I look at it is, and they really set out to clarify what voluntary meant, and what a health benefit offering is. And it appears to me that they are still allowing some pretty generous incentives to be in place for an employer. So I think that it's still very much alive for employers to be able to incent their employees to take a biometric test, as long as it is something that the member is agreeing to as far as disclosing some basic health information and or taking a screening. So one of the things that we do at Health Advocate is we have what we call our wellness program coordinators, because we all know that the wellness programs are very unique. Each employer wants their own program. And the success I think that we have found is that we need to assign a true wellness expert to each employer who's designing these programs. So they'll work with the employers and work with the employer's legal team to really determine what their comfort level is in incenting their employees. And whatever that is, we're going to help them design a program that really is going to encourage engagement and activity. So I don't foresee it as ending, wellness as being a key driver of improved health and productivity.
Sure. No, that's good to hear from you. Yeah. And I think, one of the things that we just thought was ironic about it is, the ACA had really good wellness provisions in it. And this was sort of, we were really at the council hoping that these would be sort of in harmony with that. And so we'll see where it goes. I think there's a couple of lawsuits that are pending out there. But I wanted to thank you, Kate, for spending some time today and just sort of walking us through what Health Advocate's up to and learning more about the good work that you're doing. So really appreciate it. And with that, thank you for joining us for the Council podcast. This is Sound Insights and New Perspectives from the Council.